Good evening, everyone. My name is Julie Menders. I'm the Adult Programming Coordinator at Otis Library in Norwich, Connecticut. Welcome. Thank you so much for joining us this evening for our program. Our guest speaker is John-Manuel Andriot. He is going to be speaking this evening on the topic of health and resilience in the LGBTQ plus community. John is a Norwich native. We're just so pleased to have him with us because he's been a lifelong writer on this subject. He's a longtime health and medical writer. He's writes the Stonewall Strong blog on resilience for Psychology Today. This is named for his book, Stonewall Strong, Gay Men's Heroic Fight for Resilience, Good Health, and a Strong Community. He's an award-winning author, journalist, speaker, and communications consultant. I encourage you to visit his website, which is his name. Also, his blog is fantastic. His latest topic we have shared on the Otis Library Facebook page, so I encourage you to check that out. We're so happy that he's here to speak with us this evening. We do ask that you keep your microphones muted, and you can save your questions for the end. You can either put them in the chat, or at the end you can unmute yourself and ask the questions, whatever you're most comfortable with. So I'm going to welcome John and see if there's anything he would like to start the program with. Otherwise, I'll go ahead and start asking him questions.
Well, the only thing that I would open with is just saying thank you to all of you for joining us in considering this really interesting and I think inspiring topic of LGBTQ people's extraordinary resilience. And I hope that in our questions and answers that you'll have a sense of just how special that resilience is.
Yes, thank you, John. We're so excited to have you with us. John's located in Atlanta, but he is a Norwich native, and for years he spoke at Otis Library for his for different book discussions, for different events, and it was always so interesting to have him there. But this is the next best thing. So welcome from Atlanta.
Thank you. Thank you.
Okay, so I'm going to go ahead and start with the first question. You just actually used the term extraordinary in talking about LGBTQ people's resilience. And why do you choose that word? And that's also in the title of the program. It's in the article that you've written recently. Why do you choose that word?
Well, I will answer a question that I know you're going to ask and combine it with this. And that is, first thing is to define what I mean by resilience. And the American Psychological Association defines resilience as the ability to basically bounce back after difficult experience. And in my use of the word and the concept, resilience has a lot to do with recovering from difficult or even traumatic experiences. And the reason I say LGBTQ folks have extraordinary resilience is because we also experience extraordinary trauma. And literally from the time we're little kids, brought up in a culture that still doesn't fully value us or teach us to love ourselves in a healthy way. And the fact that most of us do become resilient and live productive lives, as adults is, I think, pretty extraordinary.
I would agree. I would agree with that. And you actually, I'm just curious, how exactly did you get interested in writing on this subject? Because you've written on a variety of subjects over the years, and all of a sudden now you've turned to resilience. Why? What made you do that?
Well, I mean, for many years, about 35 years, I was not only writing about health and medicine, but I was specializing in writing about HIV and AIDS. And Dr. Milhofer and I were just, referring to my 1999 book, Victory Deferred, How AIDS Changed Gay Life in America. So in Victory Deferred, I did hundreds of interviews for the book, read lots of articles, lots of books, drew from many resources to document the suffering and loss within the gay community around the United States, but also to document the incredible organizing and mobilization and fundraising that our community also did at the same time that we were dealing with this terrible health crisis. So that was the background, really writing about um, AIDS and the traumas that it inflicted on us and our lives and our hearts as we witnessed, the terrible illness and death of our loved ones. Um, and so as the years went by, as my years accumulated, I got very interested in the subject of resilience because um, of research that I knew that kind of made a case for gay men's exceptional resilience. Dr. Ron Stahl at the University of Pittsburgh, um, has done this really interesting research where he shows that while there's a disproportionate amount of what you would call self-destructive behavior among some gay men. The fact is, when you actually look at the numbers, the overwhelming number of gay men who experience the same kinds of traumatic experiences do not turn to drugs, do not turn to self-harming practices as a way of anesthetizing the pain that they experience in their lives. That somehow most of us find a way to work through our trauma and to move beyond it. And I got really fascinated with that. And I asked, where does that resilience come from? And how do we tap into that? How do we build that in young gay people, young LGBTQ people? How do we transmit that wisdom to younger folks coming up? Um, so that was how I got interested in it. And, I had already been writing about gay men and health and medicine. And so when I wrote Stonewall Strong, my last book, it just seems like I call it a bookend of Victory Deferred, where Victory Deferred documented kind of the suffering and the trauma. Um, Stonewall Strong celebrates the resilience and all the good things that we learned about our own power from our difficult experiences, including the AIDS epidemic.
And I would say that Stonewall Strong is brilliant. If anybody hasn't read that yet, I strongly encourage you to read that. That's an amazing book. And when you talk about resilience in young people today, are you seeing this? Are you seeing that people at a younger age are more resilient than they were possibly in the past? Because you've seen this whole journey.
Well, actually, no, I wouldn't say so. I mean, we hear a lot about the mental health crises among younger people. And just, was it yesterday, the Surgeon General, came out supporting putting tobacco-like warning labels on social
On
media.
social media, right?
Yeah,
Yes.
because they're really harming young people. Um, Not just the things that they're open to, reading on social media, but the fact that they're spending all their time looking at a screen alone rather than hanging out with their friends and sort of doing the fun things that young people traditionally have done. So no, I think there's less resilience among younger people right now, but I don't think that implies hopelessness.
Okay.
I think that it can be developed. That's the thing about resilience. You can learn to be resilient.
Right. And would that be coming from the schools? I mean, what could a community do? Uh, say a community like Norwich, what could they do to help turn that around in young people?
Well, I think, the way to turn it around is to embrace young people and to acknowledge the difficulties that they face and that they do deal with um, challenges that, I didn't face when I was a kid. There was no social media. There was, these sorts of things. We had other things we had to deal with, but not that. And I think that, as is the case here, if we're talking about LGBTQ people, the real key or a key for resilience is um, teaching people, making people feel loved. I mean, that's really the bottom line, and valued and respected. And it's incredible how people typically rise to the occasion when they feel loved.
Wow. Very well said. That's beautiful. Well, speaking of Norwich, you originally came from Norwich. Tell us a little bit about your career and what it meant to you growing up in the city of Norwich and then moving. I knew you were in DC for a while. You've lived in a couple different places. I'd love to hear your story about what you felt leaving Norwich and then coming back for a period of time as an adult.
But yeah, it was a very interesting experience to have left Norwich when I went away to college. And back then I wasn't quite 18 years old. Um, and I couldn't get away from Norwich fast enough, and from my family and from everything else. And I just wanted to kind of stake out my place in the big world out there. Um, and so let me see. I mean, I actually went to and graduated from an evangelical college, even though that's not what I grew up in. I was raised Catholic. Um, but I went to Gordon College in Massachusetts, where to this day, I mean, I still say that I got an excellent education there, liberal arts education that I've never regretted. Um, and let's see. I mean, from college, I lived in New York, and one thing, then I wound up moving back to Boston, and that's where I started thinking about a writing career and what that would look like. And I was taking classes in the early 80s, graduate classes at Emerson College in writing and publishing. They had a master's program that I was in. But at some point, I realized, I didn't want to be a book editor. I wanted to write books. I wanted to be a writer, not the editor of somebody else's writing. And so then I decided that journalism, well, this is, the mid 80s when journalism was still, I don't know if respectable is the right word, but it was a field that someone could consider making a living
Mhm,
as a writer.
mhm.
And so that was my objective, was how can I actually make a living as a writer? So I wound up going to Northwestern in Chicago to do a master's in journalism, and that was in 1985. And if you recall, I mean, 1985 was a really pivotal year in the early AIDS epidemic. That was the year that Rock Hudson, went public about having AIDS. There was a lot of fear, a lot of uncertainty. Um, and that was also the year that the first two of my friends died from AIDS. One was 27 and one was 30. And so, that global pandemic was now very personal for me. It wasn't only affecting my community, it was affecting me. It was affecting my circle of friends. And so Later in 1985, I was in Washington, D.C. as part of my master's program, and I met a man, Bill Bailey, who became the love of my young life. And Bill was very passionate about AIDS. He was an AIDS buddy at that point. And the first night we met, we talked all about AIDS, and Bill being the person he was, it just cut me no slack. And he said, it's your duty as a gay man who is also a journalist to use your skills to document our community's experiences in the AIDS epidemic. And so through Bill, I met a number of people who were some of the first people involved doing bereavement uh, counseling with gay men, um, buddy program directors, and so forth. Basically, I met my first kind of sources for articles about AIDS through Bill. And my very first article about AIDS was focused on loss and bereavement. It was called The Survivors: How Do You Grieve the Loss of a Forbidden Love? Um, and so that was the beginning. And then I wrote more about AIDS. Wrote more about gay life for The Advocate, for the Washington Blade. Um, and it just sort of grew from there. And I leveraged my freelance work into full-time job opportunities for, National AIDS Organization. I worked for the American Psychiatric Association's AIDS Education Office. Um, and that I was working at the APA when I left there in 1994 to begin working on Victory Deferred. And so it's sort of, build one thing built upon the other. And I was specializing in writing about HIV, and then more broadly, writing about health and medicine. And I started writing for the Washington Post and other, mainstream publications.
Well, and do you feel that by writing about such an important and in so many ways such a painful subject, did that help you with your grieving process at all?
Well, I certainly shed a lot of tears uh, in my work. Um, it was very difficult, really. And, when I wrote Stonewall Strong, actually, the opening chapter of Stonewall Strong is really the repurposed, what I call my HIV coming out story that I wrote for the Washington Post in 2006, after my very unexpected phone call from my doctor in Washington after my annual checkup and telling me, I have bad news on the HIV test. Um, and so, it took me a few months to kind of recover my balance a little bit. But I knew right from the start that how how I would choose to live as a person with HIV, like so many of the people I had known and interviewed over the years, it wasn't an option for me to, because I knew those people, to be in the closet about it, to sort of buy into the stigma and shame that too many people attach to HIV. I never bought that. I never believed it. But um, I did realize that, my ability, and I don't know that it comes from a totally healthy place, of being able to sort of suppress really painful feelings is what allowed me to write about these really difficult subjects. Um, so yeah, I don't know if it helped me grieve, but um, it certainly helped me put into words, some very difficult, hard things.
And was your experience different, your personal experience different going from DC to coming back to Norwich? What was your relationship like in the community here, as opposed to in DC, where it sounds like you had a great community of friends, of supporters when you were there. Was that different when you came back to Norwich?
Well, one of the hardest things about moving from DC back to Norwich, besides going from this major cosmopolitan city to
Sure.
a very small city, was that no one I knew in Norwich had the experience that I had of losing all their friends. Um, that was one of the hardest things, is knowing that there's no one here who I can relate to, and talk to about something that had been such a huge part of my life. Um, and I lived back in Norwich for almost 14 years. I moved back there in 2007 after 22 years in DC. And then I left in 2021 and moved to Atlanta. Um, and I mean, there are a lot of things that I love about Norwich. And we were talking earlier about the history. I mean, I just love that. I have always loved that about Norwich. And living back there, I just soaked it up. I mean, I've always said that my journalism career started in my eighth grade class at Kelly, well, it was then Kelly Junior High, now Kelly Middle School, when I did what was basically a photojournalism project for my class, where I went around Norwich town, around the green, and I took pictures of all these colonial homes. Um, and I went to the old burial ground in Norwich town, and sort of tracked the owners of those homes to the graveyard there. And then
Oh,
at
that must
Otis
have been so
Libraries,
fascinating. Yeah.
it was fascinating.
Yeah.
And then at Otis Library's local history room, I spent a lot of time there researching those founders of Norwich and so forth. And so I was completely fascinated by the genuine, deep American history in Norwich. And I love the area. I think it's beautiful, and I miss it.
Oh, you talk a lot about the different writing that you've done over the years. What do you think about the changing face of journalism? Because you've worked for magazines, you've worked for newspapers, you've written books. I mean, how do you see it changing? You can't really think. It's not changing for the better. That's for sure. I just would love to hear your opinion on it.
Well, I think, I mean, two things that really revolutionized journalism were the internet and digital technology. And I love both those things. I mean, here we are on Zoom, made possible by both of those things. And and so I do love that. Um, what it meant for me in my career was that if I wanted to continue to work, I had to learn how to use those technologies, and become expert at using digital video editing and, that sort of thing, doing internet assisted reporting, as it was called. I mean, I think one of the biggest problems with journalism is that it has become kind of blurred with entertainment. And I think that there's this desire to sort of feed the people, cotton candy, rather than taking seriously the First Amendment role for the free press, which is to inform the citizenry so that citizens can participate in our democracy. And I don't think journalism today, most of it really um, operates with a full respect for what its role is supposed to be.
Yeah, unfortunately, I agree with you. Having said that, if there was anyone interested in in pursuing the field of journalism or writing, or would you recommend the way that you started college, getting the degree, and then building up and eventually writing your own books, that sort of thing? What would you suggest?
Well, I mean, I went to, journalism school. I did a master's in journalism, and all these years later, I'm not really sure that journalism school was necessary.
Oh,
I
really?
think, I think that the advantage that it gave me was in terms of the contacts that I made, um, and the credibility that it gave me, especially early in my career,
Mhm.
when I was starting out in Washington, D.C. Um, so that, going to the Medill School of Journalism at Northwestern kind of opened some doors in terms of accessing people I wanted to interview in Washington. But then it became more about, you know, building my own reputation rather than just building on the reputation of the school. So, my recommendation to young people who want to pursue a writing or journalism career is it's similar to, it always has been, write what you know. That's the ancient dictum, for writers, write what you know. And of course, you can learn more so that you know more and you can write about more. But, write with authenticity and honesty, and emotion. Writing is also important in terms of conveying emotion and communicating emotion with people. Um, so, I started out writing for the LGBT press, writing for the Advocate, writing for the Washington Blade, writing for Washington City Paper, which was an alternative weekly paper. Um, and then leveraging your, well, we used to call them our clip files. Now it's more like our links, to our
Sure.
digital publications. Um, and you build a portfolio of your work and you kind of build upon that
Mhm.
and get bigger and better and hopefully more lucrative assignments.
And how did you come to writing to write for Psychology Today? Because when you talk about, being passionate about something, having the emotion show in your work, it definitely, when you read your articles, your blog posts in Psychology Today, that's what comes through very strongly. Um, how did that come about for you?
Well, in 2017, when Stonewall Strong, the book, was published, um, I'm trying to think. I had reached out to Psychology Today, and I sort of pitched myself to them. And at the time, I was working with a literary agent, and she discouraged me. Um,
Oh, really?
and I wound up telling her we wound up parting ways because and I told her, I said, here are three examples of how you have told me not to do something that I've gone ahead and done anyway, and in all three instances they turned out very positively, and if I had listened to you I wouldn't have acted and I wouldn't have those opportunities. So, and I was very surprised because before becoming an agent, she was an elite athlete. And I would think that someone with that background understands pushing her limits, and pushing beyond limitations.
Sure.
Um, so that's how it started. And for the last going on 7 years, I've been writing the Stonewall Strong blog for the magazine.
Mhm. And it's brilliant. Very well done. Very well done. So just in parting here, I'm thinking about different questions that anybody in the audience might have. You can unmute yourself, you can put them in the chat, whatever you're comfortable with. But if you have any questions that you'd like to ask John, feel free right now. And John, if there's anything that you feel like I haven't covered that you would like to share with people.
Well, I'm happy to answer questions. I, I mean, one thing, and this is from very recent experience of mine in terms of talking about resilience, is I think that a lot of people seem to confuse the idea of resilience with, well, I was going to say stoicism, but that's not the right word. That the idea that if you're resilient, then when something bad happens to you, it's not going to affect you. You know, that you won't have feelings about it, you won't be upset, you won't cry or be angry or whatever. And I don't think that's true at all. I think that resilience has a lot to do with sort of looking back in retrospect at a difficult experience so that, you know, and I wrote about this recently for my blog. Um, and that was, you know, a couple of weeks ago, I made my first trip to Paris and I was there by myself for a week. And the first day that I was there, my wallet was stolen
Oh my goodness. Yeah.
and I had rented this very tiny, like really small apartment for a week. And the first night I was locked out of the building because the property manager had not given me the code to the front door. And so, you know, I had discovered my wallet was missing when I got to the apartment after I came from the airport, and it had been in my backpack. And I was wearing my backpack on the subway. And, you know, it hadn't occurred to me that a pickpocket can just as easily slip their hand in a backpack as in your pants pocket. Lesson learned. Fortunately, my passport, my driver's license, credit cards, and money were somewhere else. So I had those, thank God.
Hmm.
Uh, the as far as being locked out, you know, 11:30 p.m. I came back from my tour up the Eiffel Tower, kind of all filled with joy at that experience, only to find that I was locked out of the building, you know, and then it was like, oh my God, I've never been in Paris. I have no idea, you know, where I am.
Did
I
you
don't
speak the
know
language?
anyone here.
Do you speak the language?
Je parle français, so I could speak French well enough, you know, to sort of ask questions and so on. But 11:30 p.m., I mean, there's nobody around. And so then it was a question of like, okay, what do I do? You know, I need a place to stay. So fortunately, I had enough battery power in my phone. I was able to Google, like, find a hotel near me, find a cheap hotel near me. And so I found a hotel, you know, it cost me 90 euros for the night. So I wasn't happy about that, but I was very relieved, you know, just to have a clean bed to sleep on. The next morning, I called the property manager and she met me at the building. She told me the code and she apologized profusely. And so the point that I'm trying to make is that, you know, I was really not happy in both of those situations. I was really scared. I was really anxious, you know, when my wallet was stolen, when I was locked out of the building. I mean, it really rattled me. But um, after I realized that I had money, that I had my passport, you know, I was like, okay, lesson learned. Um, After I got into the apartment that next morning, and I realized it's going to be okay for the rest of the week, the next 6 nights, you know, I have a place to stay. and I can get in. And I made up my mind. I said those unfortunate experiences are not going to ruin my week in Paris. You know,
Good for
how
you.
wrong would that be to allow those things
Mhm.
to wreck like this place that I had dreamed of my whole life? So that was really, for me, a lesson in resilience. You know, I might not have seemed very resilient while I was feeling like I wanted to cry at the end of that day. I mean, I was just like, oh my God, I was exhausted from the long flight and from walking more than 8 miles that first day. I mean, I was physically exhausted, but I said, you know, and literally like 2 days after that, I was sitting at a cafe and this American couple from Washington, D.C. were sitting at the table next to me, and we started chatting, and I told them about these experiences. And, you know, Monique, the wife, said in French, you know, c'est la vie. And that was really it. C'est la vie. You know, stuff happens. I mean, not happy stuff,
Mhm.
but are you going to ruin your whole vacation because of those unfortunate things, or you're just going to say, lesson learned, moving on. And that's what resilience is.
And do you think that resilience, having lived in different parts of the United States like you have, does it mean something different in the South? Is it, you think of it, New England, you use the word stoicism, think of New England, you know, the backbone, right? So do you think it means something different in different parts of the country or even in different parts of the world?
Hmm. Um, Not that I'm aware of. I mean, I think that you know, emotional resilience, psychological resilience is kind of a universal. It's a human thing. Um, so yeah, I don't know. I mean, I have talked and written about Yankee grit, you know. I mean, what New Englanders are known for because of having to survive the harsh winters and, you know, and for me, the stone walls um, that I revere after actually writing this big article for Earth magazine about New England stone walls, you know, I learned everything there is to know about them and their history. And I absolutely see them as uh, emblems of Yankee grit and symbols of resilience, and I really respect them.
Mm,
So yeah, I don't know. I mean, the resilient people I know here and other places are they're resilient in the same way, I guess.
mm. So we have a question in
Let's
the
see.
chat. Do you see that, John, or would you like me to read it to you? It says,
Oh, Ron Stahl, Stall, at the University of Pittsburgh.
yeah, in case anyone can't see it, the question says, you mentioned a trauma researcher, Ron Stahl. Can you tell us how to spell Stahl? Stall, you said?
Yeah,
Mhm. Sure. Go ahead,
sure.
John, ask a question.
Hi, thanks so much, John, for your talk on resilience and the LGBTQ community and its health. I wanted to ask you about the period of time in the 1980s when there was so much organizing around trying to get decent healthcare policies and um, I read something in the New Yorker around that effort when it came to the CDC and the interface with Dr. Fauci. And I wanted to know if you wouldn't mind talking about, you know, that how it happened to finally get the kind of healthcare policies if in fact they were achieved around the HIV crisis.
Well, it's funny you mentioned Dr. Fauci because I literally, before our meeting here, I was just reading his brand new book, which just was released today, called On Call. I interviewed Dr. Fauci a couple of times over the years, and and really respected and admired him a lot because I knew when he was dealing with the COVID crisis a couple of years ago, I knew that he had been tried by fire by AIDS activists back in the 80s and early 90s. And that was why I respected him and felt he had enormous credibility. Um, yeah, it was very interesting how AIDS advocates, um, you know, lobbied and protested Dr. Fauci, Larry Kramer, probably the most famous AIDS activist. I mean, he called Dr. Fauci a murderer, in public and in print. Um, and over the years, though, uh, Fauci and others within the National Institutes of Health and CDC here in Atlanta, um, they came to develop a mutual respect for one another and realized that, fundamentally, they were all fighting for the same thing, which was health justice, for all people, all Americans. Um, and uh, Dr. Fauci was, very involved with, well, especially with the development of PEPFAR, the President's Emergency Plan for AIDS Relief that President George W. Bush announced in 2003 in his State of the Union address. And I remember watching, because I watch every year, no matter who's president. I love to watch the State of the Union. I think it's a great American moment. Um, and I remember watching it that year and, hearing President Bush talk about PEPFAR, and I grabbed my notebook and started writing notes because I knew how incredibly important that was. And um, so I think that, huge strides were made in terms of protecting the interest, protecting the health of people with HIV. The 1990 Americans with Disabilities Act, also in 1990, the Ryan White Care Act, which was, a massive federal program to support care and supportive services for people with HIV and to support paying for drugs for those who didn't have the money, and who does, who can afford tens of thousands of dollars a year, for one medication. I know I can't. um, so I think that, until we have universal health care, that where we treat health as a human right and not an economic opportunity, um, we've made progress, but there's still a long way to go. Um, I don't know if that answers your question.
That was a great question. Does anyone,
Thanks so much. If anyone doesn't have a question, I'll have another question. Thanks.
oh, go ahead.
Okay, I don't want to take up all the space, but if John or anyone else would like to comment on this, so this is a little more on the personal level. I have a family member who's a young adult who in the last couple of years has come out and identified as a trans person. And I just wanted to ask what kind of resilience allyship would be helpful in terms of that relationship. Thanks.
I have a a niece who was formerly my nephew. So I have, within my family, like a trans person, trans individual. Um, and, my response to Kayla, um, who used to be Caleb, was I said, I don't understand it. I um I've been attracted to other males since I was a little boy, but I never wanted to be a little girl or a woman. So I said, I don't understand it, but I will support you. And I think for me, that's what it's about is, I don't have to understand the whole trans experience, but it is up to me to provide love and support. And as I was saying earlier about, resilience and helping young people to be resilient, I think that's really a cornerstone of resilience is simply knowing that you are loved and accepted as you are is huge. Anyone else?
Thanks for that answer.
You're welcome.
Jana, those were two great questions. Thank you. Do we have any other questions? In the meantime, John, if you could tell us what you're working on now, what you have coming up.
Well, I mentioned earlier that I have, my day job as magazine editor and writer for Winship Cancer Institute at Emory University. So, I mean, that takes some of my time, but only some of my time. And my job is remote, which I love. So all my meetings pretty much are on Zoom. So the nice thing about that is that it provides a nice salary and benefits that I didn't have for years and years, that I was pursuing my writing career. I mean, I truly know what it means to be a struggling writer. Um, to feel like I want to be true to myself and what I believe I am called to do in my life, but not making a lot of money doing it. It was always very frustrating and discouraging. So I feel now I have that sort of foundation, that I'm aware that I have all this time on my hands and I'm not working on a book project. And it feels like I need to be because I don't like having so much unstructured kind of free time. That said, I have been working with a publicist to put together a little media campaign to remind LGBT media in particular about Victory Deferred at its 25th anniversary here. And it's not it's not that I need the ego gratification, but I'm very aware that in the 25 years since that book was published, there has been no other book like it that documents the origin stories of, I don't know how many community-based organizations around the country. I interviewed the founders and the pioneers of these organizations. I mean, from Gay Men's Health Crisis in New York to Alliance for Living in New London and AIDS Action Committee in Boston. And, literally, I mean, Little Rock and Atlanta and San Francisco and Seattle and Houston. And there's no other book that really connects the emergence of the community-based response to AIDS with the growth of the national LGBT equality movement and shows how literally how AIDS built the movement. It brought out many people, it brought many allies, friends and family, the fundraising that was done, for AIDS, built, you know, gay and lesbian organizations, and built the movement in Washington to the point that it is today. And I think that's a hugely important piece of our community history, but also the fact that all of the interviews, all of the research notes, reporters' notebooks, everything I used to develop the book is collected by the Smithsonian's National Museum of American History. You know, the John-Manuel Andriot Victory Deferred Collection. And for me, that is my proudest personal accomplishment, because all those interviews, everything in that book is available for historians and journalists and others to use in the future. But I do want to be sure that people know that it exists. So that's kind of my motivation now. And I also still really want to do more marketing for Wilhelmina Goes Wandering, my children's book based on the true story of a runaway cow in Connecticut, which of all the books I've written, I love that book the most.
It is wonderful. Thank you so much for sharing your time with us. I don't want to miss anyone. If anyone has any last minute questions, feel free to unmute yourself or put them in the chat. Otherwise, we're coming to a close for the evening, and I just want to thank you again, John. This has just been so informative. It's just so great to talk with you again. I can see that you're flourishing in Atlanta. You seem so happy there. So if I don't see any more questions, just like to thank everyone for joining us this evening.
I see.
I see a hand up. Yep, go ahead, Jeffrey.
Can you hear me?
Yes, yes.
Okay, good. Apologies. I was trying to come in on my phone, and it was earlier. It was not working on my end, so I ended up going on my laptop. But I'm just. It's not really a question, but I really mentioned, you know, your previous work in collecting the stories of community organizations, and since working with a lot of those types of organizations in Philadelphia is actually part of my job, I'm very interested in that, and I'm gonna look that up. But I just want to thank you. And I've been enjoying your stories on Facebook for a while, and I appreciate it. Thank you.
Well, thank you. I'm glad you joined us here.
John, you'll have to be sure to keep us in the loop and let us know with when you have any new projects coming up, and if there's anything we can do on our end here in Norwich to help promote any of your projects, let us know. So.
Well, thank you, Julie. I really appreciate that.
Yeah.
I mean, it's really nice to know that, you know, my hometown is and Otis Library in particular, because the years that I lived back in Norwich as an adult, you know, I certainly was very aware of the huge role that Otis Library plays in the community. So I really appreciate that.
Well, congratulations on all your success, and we'll definitely be talking about Victory Deferred. So that maybe I almost feel like that should just be a separate program, a separate project. So if there's anything that you can think of that we can do on our end, let us know. And thank you everyone for joining us. We have recorded this program, so it should be, if you know anyone who was not able to make it this evening, we should have it up on our YouTube page in the next week or so. So visit Otis Library's website to find out about that. Any last minute words of wisdom for us, John?
No, I just want to thank you all for taking time to be here. I really appreciate that.
Excellent. Well, listen, take care and good night, everyone. And thank you again.
Thanks, folks.